Assalamu alaikum. My name is FAISAL BASHIR. Today I am going to present a case of imperforate vagina with secondary septic hydrometrocolps in 2 years old female alpaca. The alpaca was weighing 54.5 kg and there is a complaint of difficulty in urination and defecation, what we call stranguryatinismus from last 5 days, and there is abdominal pain. The alpaca was recently mated several times, but there is an abnormal mating because of short duration mounting, and there is a bleeding afterward. The alpaca was also vaccinated and dewormed, so these causes can also be excluded. Okay, on the physical examination, what we found was there is an increase in the heart rate, breathing rate, and there is abdominal pain, and there is no vaginal discharge. In the CBC, what we found was there is a mild anemia with severe neutropenia, means there is a severity of infection. In the serum chemistry, there is what we found was there is a muscle damage, there is a decrease in phosphorus, potassium, and there is a mild ketosis, means that can be due to stress or decrease in the appetite. In the imaging, in the ultrasound, what we found was there is a dark or hypoechoic fluid in the uterus, cervix, and there is a vagina. And we also found corpus luteum on the left ovary. This means that the animal was in the luteal phase. Okay, we also found was there is the vestibule was ended at the cranial portion of the urethral opening. And in the vaginoscopy, it was confirmed that there is an imperforate vagina and there is no wake tissue available for boginage, a surgical procedure in which we pass a rod to dilate a tubal passage. On the basis of the ultrasound and vaginoscopy and on the blood and serum chemistry, we can say it is a most likely chances of imperforate vagina with secondary septic hydrometrocolps. Why we can say? Because of a blind pouch vagina and fluid present in the cervix and vagina and the uterus, and due to severity of infection that is showed in the blood and serum chemistry. Unfortunately, due to the severity of the infection and the poor prognosis, the alpaca was euthanized and when the necropsy was performed, it was confirmed it was the case of imperforate vagina with secondary septic hydrometrocolps, and there was also adhesion found between the bladder and the vagina, and the clostridium infection was there. The outcome was that the alpaca was euthanized because of poor fertility prognosis, and the surgery cannot be performed due to the severity of the infection. So it is we can conclude that there is a need of early detection of the congenital defects to prevent a fatal complications. Okay, it was a congenital defect in which paramezonephrine duct failed to fuse, lead to imperforate vagina with the fluid accumulation, and due to the severity of the infection, we call it imperforate vagina with secondary septic hydrometrocolps. If there was early detection of this defect, the animal could be survived, but due to the severity of the infection, the surgery was not performed and the animal was euthanized. So it was all about the case. Thank you.